Have you ever woken up with slightly puffy eyes and told yourself, probably just a late night? Have you ever gotten up to use the bathroom more than usual at night, and then forgot all about it by morning? And did you know your 2 kidneys quietly filter over 100 liters of fluid every single day to keep you healthy? In just a few minutes, you'll learn how to read those quiet signals. You'll know 3 super quick at-home checks to spot early risk. And you'll get a simple 14-day checklist, so each new day becomes a step toward protecting your kidneys. This isn't a scary story. It's a gentle journey back to balance, one small step at a time. Kidneys don't shout, but if we're willing to listen, we can understand what they need in time. Important note: the information in this video is for educational purposes, compiled from reputable public sources. It does not replace professional medical advice. Before applying any tip, please consult your doctor or a qualified healthcare professional. We share this because we want you and your family to stay healthy and happy. Thank you for joining us on this journey to live well and live wisely. In this video, I'm not just telling a story. I'll guide you through the small but meaningful signs, how to tell them apart from common causes, and when to schedule a doctor's visit. Everything is explained in everyday language so you can start today. No fancy gadgets, no drastic changes. You'll come away with 1. How to track urine, weight, and blood pressure at home without overthinking it. 2. How to tell just salty food from swelling that deserves a checkup. 3. A tidy screening roadmap so you know exactly what to ask your doctor. You'll also pick up a few small habit swaps that lighten the load on your kidneys. Easy to do, easy to keep. If you find this helpful, please like the video so the algorithm shares trustworthy health content with more people. Subscribe and turn on notifications so you don't miss upcoming videos on kidney care and overall health. A single click from you might help someone catch a problem early. Now let's start in the most familiar place, the morning bathroom, where your body sends you its daily report. Let's dive in. Part 1. Sign: changes in urination. Reading your body's daily report. Think of your morning bathroom as the place your body sends a short report. Your urine is a subtle note about how your kidneys are working. When you pay attention, small shifts in frequency, sensation, foam, and color can say more than you'd expect. What's normal and what deserves attention? Frequency and timing. You may go more on days you drink lots of water or coffee, or when you're more active. But if nighttime urination starts happening more often than before, or you're peeing very little despite drinking normally, that's worth logging. Sensation when you pee. Distinguish urgency, the need to go right now, from a weak stream, slow flow. They suggest different issues, an overactive bladder versus something affecting outflow. Foam in urine. Brief foam from a strong stream isn't a worry. What matters is thick, persistent, recurring foam, which can be your cue to ask about kidney health. Urine color chart: straw to light amber usually reflects hydration. Tea, cola, or pink red are signals not to ignore. Log them and discuss with your doctor. Analysis and comparisons. Not every change points to the kidneys versus a UTI. UTIs often bring burning pain, sometimes fever or lower abdominal discomfort. If you only see color foam without burning or fever, it may be a different story. Versus blood sugar issues. Excess thirst, drinking a lot, and frequent urination over time suggest checking your glucose. Versus dehydration. After workouts or low fluid intake, darker urine can simply be your body's please drink reminder. If you've rehydrated but color still looks off, keep logging and watch the pattern. Common mistakes. Chug water to flush the kidneys. Overdoing fluids isn't always helpful. Let color guide you. Aim for pale yellow, not crystal clear all day. Ignoring persistent foam. Just because it isn't painful doesn't mean it's nothing. Patterns over time tell the truth better than a one-off glance. Trusting a single data point. One dark urine after a workout isn't a verdict. Several days in a row deserves attention. Small takeaway: turn attention into a gentle habit. Do a simple 3-day urination log. Count daytime trips and nighttime awakenings. Note color quickly: pale, darker, tea, other. Record urgency or weak stream and whether foam persists. That's it. No pressure, no perfection. These small notes make the picture clearer. What's just lifestyle fluctuation and what's worth bringing to your doctor? When your daily report suggests your body isn't handling fluid well, that fluid can pool where you can see it: ankles, feet, or morning eye puffiness. In Part 2, we'll read the next signal: swelling edema, why it happens, a quick at-home check, and when to pay closer attention. Part 2, swelling edema, where it shows up and why. When the body hangs on to fluid a little too well, it sends a visible postcard: swelling. It might be a light eyelid puff in the morning, heavier ankles by evening, or sock marks that linger. Swelling isn't always serious, but a repeating pattern is worth listening to. What's going on? Edema is fluid that leaks out of blood vessels and settles in tissues. With kidney-related imbalance and saltwater control, the body tends to retain more fluid, which pools where gravity rules. Ankles, feet toward late day, eyelids more in the morning. Early signs: shoes, socks feel a bit tighter, imprints linger on the skin, legs feel heavy after standing. Analysis and comparisons. Not all swelling is from the kidneys. Kidney-leaning clues. Both sides affected: morning eyelid puffiness, gradual weight creep, blood pressure trending up, or persistent foam in urine. Versus the heart: swelling with shortness of breath when lying flat, needing extra pillows, or getting winded easily. Think heart-lungs, too. Versus liver abdomen: rapidly increasing abdominal size, tightness, fluid in the abdomen, sometimes with leg swelling. Veins, lymph, or posture: one-sided swelling, color, warmth changes, or hours of sitting, standing may not be kidney-related. The key is context: when it appears, where, and what else shows up with it. Simple self-checks. Pitting test. Press a fingertip over the shin or near the ankle for 3 to 5 seconds. If a dent remains and takes a moment to fill, that's pitting edema. Morning weight log. After the bathroom, before breakfast. A 0.51 kilo bump over 1-2 days without explanation can suggest fluid retention. Timing and symmetry. Note morning, evening, and one versus both sides. This helps your clinician triage. Common mistakes: blaming only a salty meal. A single salty dinner can cause temporary puffiness. Repeating over days/weeks shouldn't be ignored. Self-starting diuretics can dehydrate you, upset electrolytes, and mask the real issue. Medications need medical guidance. Fixating on eye creams alone. Creams won't replace tracking weight, blood pressure, and salt habits. Small takeaway: a 3-step edema mini-log. 2 minutes day. Morning weight. Watch trends, not single days. Ankles and socks. Are imprints lingering? Are shoes, socks getting tighter? Same pitting spot, same time each day for consistency. From these tiny data points, you'll quickly see what's posture salt-related versus what's worth asking your doctor. When the body holds too much fluid, it's not just ankles or eyelids that speak up. Your energy often shifts too, feeling more drained, less focused, as if a thin fog has settled on your mind. In Part 3, we'll lift that veil: fatigue and brain fog, the EPO anemia link. Part 3, fatigue and brain fog, the EPO anemia link. Some days feel like the engine won't catch. Life looks the same, but your energy drops a notch and your thoughts lag half a beat. It's a quiet signal. Take a deeper breath. And when kidneys struggle, it visits more often. Why kidneys affect stamina and clarity. EPO's role. Kidneys release erythropoietin, EPO, the sheet music that tells your bone marrow to make red blood cells. When EPO falls, fewer red blood cells deliver oxygen to brain and muscles. Fatigue, lightheadedness, mild shortness of breath, and trouble sustaining focus. Waste load effect. If filtration slips, waste builds up, contributing to brain fog, that hazy, hard-to-organize feeling. Sleep disruption. Nocturia, leg cramps, or restless legs can fragment sleep, and chronic loss of sleep layers fatigue on fatigue. Analysis and comparisons. Kidney-related or something else. Kidney-leaning clues. Fatigue. 2 weeks plus other signs like mild swelling, persistent foam, nocturia, creeping BP, pale skin, versus sleep, debt, stress, better with solid rest and stress reduction, likely lifestyle. Kidney-related fatigue usually needs more than a good night's sleep, versus thyroid issues, fatigue with feeling cold, unexplained weight gain, very dry skin, check TSH alongside kidney labs, versus diet-related anemia. Simple iron deficiency can cause fatigue, but if you also have kidney signals, consider EPO kidney anemia too. Meds and habits. Antihistamines, alcohol, late nights, inactivity can weigh down your brain. If you've adjusted lifestyle and still feel drained, think broader. Small takeaway. A 4-question go see the doc nudge track honestly over 3-5 days. Stamina. Are stairs or brisk walks harder than usual? Focus. Is it tougher to finish tasks that require sustained attention? Sleep. Are night peeing cramps waking you 2 to 3 times a week? Companions. Do swelling, foam, BP creep, or pallor show up with the fatigue? If several answers are yes, book a checkup. Labs to discuss. CBC, ferritin, iron, B12, folate, TSH, plus creatinine, EGFR, and UACR. Avoid self-dosing iron or leaning on energy drinks. They can mask what your body's trying to say. When inner energy falls out of rhythm, skin often speaks next. Dryness, itch, prickly discomfort, like a small blinking sign. In Part 4, we'll listen to skin's language. Skin clues and itch, when minerals slip out of balance. Part 4. Skin clues and itch, when minerals slip out of balance. Sometimes your skin speaks before your labs do. Dryness that lingers, an itch that keeps returning. Tiny pinpricks that make you want to scratch. These can be quiet messages about how your kidneys are handling minerals and waste. What's happening and why skin reacts? When kidney function slips, the balance of minerals, like calcium and phosphate, and the clearance of waste can drift off. That shift may trigger dry, tight skin and a persistent itch, often worse at night. Itch can show up on the back, arms, scalp, or across the body without a rash you can clearly see. Dry air, hot showers, and harsh soaps can make it louder. Analysis and comparisons. Skin signals aren't all the same kidney-leaning clues. Chronic dryness plus itch with few obvious rashes, alongside other kidney hints, nocturia, swelling, BP creeping up, persistent foam. Versus eczema allergies, usually visible patches, seasonal triggers, or a clear contact irritant, often improves with targeted creams and allergen avoidance. Versus athlete's foot or localized fungal rashes, well-defined, localized, often peeling or cracking, e.g. between toes. Versus liver-related itch, can be palms, soles predominant, sometimes with jaundice, yellowing eyes, skin, or very dark urine pale stools, worth a different workup. Versus thyroid diabetes dryness, may come with cold intolerance, weight changes, thyroid, or thirst, urination changes, blood sugar. Context matters. Common mistakes. Scalding hot showers and harsh scrubs. They strip oils and worsen dryness and itch. Random steroid creams or detox topicals can mask issues or irritate. Strong steroids near thin skin, eyelids, groin, are risky without guidance. Ignoring the pattern. Treating only the itch, but overlooking other kidney signals, swelling, foam, BP trends. Small takeaway. A gentle skin routine that helps inside and out lukewarm, not hot showers. Fragrance-free cleanser. Moisturize within 3 minutes of bathing. Cream, ointment, lotion. Consider a humidifier in dry seasons. Cotton clothing where possible. Keep nails short. Use a cold pack instead of scratching. If itch persists 1 to 2 weeks or worsens, especially with other kidney signs, book a checkup and bring your 14-day log. When your skin is sending signals, your blood pressure often joins the conversation because kidneys and the heart move in a loop. Next up is Part 5, blood pressure and the kidney-heart loop. Why high BP both causes and worsens kidney issues, how to measure it right at home, and the 7-day diary that tells the real story. Part 5, blood pressure and the kidney-heart loop. Blood pressure is like water pressure in a delicate plumbing system. If it runs too high, tiny vessels in the kidneys and heart strain. When kidneys struggle, the body flips on salt water and hormone switches that push pressure up, and we land in a loop. High BP damages kidneys. Damaged kidneys make BP harder to control. How kidneys influence blood pressure. Salt-water balance. Kidneys decide how much salt, and thus water, to retain. Retain more, blood volume rises, BP rises. RAS system. When kidneys sense low flow, hormones tighten blood vessels and retain salt water to lift BP. If that switch flips too often, pressure stays high. Microvessel damage. High BP stiffens tiny kidney vessels. Poorer filtration means more fluid retention, cycling the loop. Analysis and comparisons. Measuring right, understanding clearly. Clinic versus home. Some folks have white coat hypertension, high in clinic. Others masked hypertension. Normal in clinic, high at home, hashash, night. That's why a home BP diary matters. One pretty reading proves little. You need a multi-day trend, especially morning, after waking, and evening before bed. Common skewers. Caffeine smoking within 30 minutes, a full bladder, wrong cuff size, arm not at heart level, crossed legs, can all fake high-low numbers. Common mistakes. Relying on a single reading. Self-tweaking meds. Ignoring hidden salt. Watching only the top number, systolic. Small takeaway, a 7-day BP diary. Prep. Rest 5 minutes. Use the bathroom first. No coffee, smokes, energy drinks for 30 minutes. Posture. Back supported, feet flat, arm at heart level, correct cuff size. Measure twice 1 minute apart, morning and evening. Record both numbers and heart rate. Notes. Meal salt, morning weight, meds taken. After 7 days, you'll have a true picture to discuss with your doctor. Once you can read your BP and the kidney heart loop, the next question is, who needs earlier, more frequent checks? In Part 6, we'll identify higher risk groups and set a smart screening schedule. Part 6, who's at higher risk and how often to screen. Not everyone needs frequent testing. The key is knowing your risk, so screening is early enough and regular enough. Who's higher risk? Diabetes, type 1 or 2. Hypertension or chronically creeping BP. Age 60 plus. Family history of chronic kidney disease or polycystic kidneys. Recurrent UTIs or kidney stones. Autoimmune disease, e.g. by lupus. Long-term kidney-impacting meds, especially NSAIDs, others as advised by your doctor. Smoking, obesity, metabolic syndrome. What does screening include? Blood creatinine, eGFR. Urine, UACR, urine albumin, or creatinine ratio. Also track blood pressure and weight. How often? Higher risk, watch one factor. At least once a year, eGFR plus UACR. Twice a year if you have diabetes, long-standing high BP, or prior mild abnormalities. Average risk, 60, no clear factors. Every 1 to 2 years for basics, especially if urinary changes/swelling BP creep appear. After any abnormal result, personalized every 3 to 6 months, depending on eGFRs, UACR, and other conditions. Common mistakes. Waiting for symptoms before testing, the early stage is often silent. Relying on a dipstick only, it can miss microalbumin. Ask for UACR. Doing ultrasound only and skipping blood urine labs. Ultrasound shows structure. eGFRs, UACR show function. Self-interpreting labs with generic online ranges. Targets vary by person. Small takeaway, a 60-second risk check. Ask yourself, do I have diabetes or high BP? Am I 60 plus, or is there kidney disease in my family? Do I use NSAIDs long-term, or have stones, recurrent UTIs, or an autoimmune condition? Lately, any nocturia, persistent foam, swelling, or BP creep? If yes to one or more, schedule this year's screening, eGFR plus UACR. Once you know your place on the risk map and have a screening plan, the next step is daily ownership, Food, movement, meds, sleep. Small choices compounded become a big shield for your kidneys. In Part 7, we'll build a daily kidney protection plan. Part 7. Daily Kidney Protection Plan. Habits that compound over time. Kidney health rarely comes from a one-time overhaul. It grows from small steps repeated. Each day, we adjust a few seats. Food, fluids, movement, sleep, meds. Light enough to do now, steady enough to stick. 5 pillars more real food, less salt. Favor minimally processed foods, simple cooking. Read labels. Pick 140 methylmalonate sodium serving when possible. Watch phosphate additives. Home-cooked meals usually mean less salt, phosphate than deli meats or ready-made meals. Hydrate by the color chart. Aim for pale yellow urine. Skip the 8 glasses for everyone myth. Adjust for climate, activity, and medications. Move consistently. Blend resistance training. Plus brisk walking. Consistency beats intensity. Medication and supplement safety. Use NSAIDs sparingly and with guidance. Share your supplement list with your doctor. Natural kidney safe. Daily rhythm. Sleep. Stress. Smoking. Alcohol. Solid sleep steadies BP and blood sugar. Manage stress. Breathing, brief meditation, walks. Quit smoking. Keep alcohol moderate. Why it works. Lower salt, phosphate, less fluid retention, easier BP control. Right-sized hydration. Supports filtration without overload. Exercise plus sleep. Better insulin sensitivity and vascular tone. Transparent meds, SUPs. Avoids hidden hits to the kidneys. Choose good enough daily over perfect once. Many low-salt meals beat a miracle diet you drop next week. 20 minutes of brisk walking most days beats 1 brutal session and a week off. A 14-day log tells the truth better than any overnight hack. Small takeaway, 14-day toolkit. Ash 3 minutes day. Morning, weight, urine color, BP, 2 readings. Daytime, mark YN for persistent foam, hidden salt, smart hydration, Kachishan 20 minutes activity. Evening, BP, 2 readings. Last night's nocturia count. Check ankle swelling, sock marks. At day 14, look at trends. Where are BP, weight, and urine color headed? When habits are humming, it's time to filter information like kidneys, filter blood. Keep the useful, let the rest go. In Part 8, Myths, Mistakes, and Internet Traps, we'll clear up the noisy detox, overhydration, and all-natural claims. Part 8, Myths, Mistakes, and Internet Traps. Once good habits are in motion, the biggest challenge can be noise. Among flashy promises, we need a gentle filter to keep what helps and let go of what harms. 6 common myths. Detox drinks cleanse the kidneys. The kidneys are your detox system. Extreme cleanses can disturb electrolytes. The more water, the better. The goal is pale yellow. Avoid overload. Cranberry cures the kidneys. It may help some UTIs, but it does not cleanse kidneys. Natural means safe. Some herbs, metals are nephrotoxic. Ultra-high protein suits everyone. Protein needs are individual. Ask your doctor if you're at kidney risk. You can read labs on your own. EGFR, UACR need context-aware interpretation. How to spot traps. 2 good promises versus small, steady changes. Anecdotes versus consistent evidence. Single tricks versus the whole picture. Common mistakes. Self-starting or changing doses, especially long-term NSAIDs. Ignoring hidden salt in processed foods. Chasing hacks while skipping basics. Sleep, movement, the BP weight urine log. Small takeaway, the 3C filter credibility. Who's speaking? Are sources reputable? Consistency. Does it align with medical guidance and multiple reliable sources? Compatibility. Does it fit your health status and medications? If any C fails, pause and ask a professional. With the noise filtered, what remains is acting at the right time. In Part 10, Action Plan, When to book, when to go now. We'll gather the key signals so you know when to schedule a visit and when to seek urgent care. Final part. Action plan. When to book, when to go now. Once you can hear your body, the next step is timing your actions. No panic, no delay, just a clear plan so you stay in charge. Yellow light versus red light. Yellow light. Book soon. Near-term appointment. New or increasing nocturia. Persistent foam in urine. Recurring mild swelling. Ankles, morning eyelids, or weight creep without reason. BP trending up versus your prior log. Fatigue, brain fog, itch lasting more than 1 to 2 weeks. Red light, go now, urgent care, ER, visible blood in urine, significant swelling with shortness of breath, chest pressure, or needing to sit upright to breathe. Very little or almost no urine in a day. Fever with flank, side back pain, chills, possible upper UTI. Sudden confusion, dizziness, or severe unusual headache. Why this tiered approach? Yellow lights are slow burn changes. Labs and early adjustments can slow progression. Red lights can escalate fast. Time matters. Go where trained teams can treat you promptly. Common mistakes. Waiting until you're free. Health rarely fits our calendars. Self-medicating, diuretics, antibiotics, painkillers to suppress symptoms. Showing up empty-handed without your BP log or med list makes visits less effective. Focusing on one number instead of the overall pattern. Small takeaway, the 1, 2, 3 before any visit. 1 appointment. Book it when you hit a yellow light. 2 weeks of logs. BP morning, evening. 2 readings each time. Morning weight, urine color, and swelling notes. 3 things to bring. BP log plus weight plus urine notes. Photos of color if helpful. Full medication and supplement list. Name, dose, frequency. Prior labs if available. Creatinine, EGFR, UACR, related records. You now have a map. When to take the turn. Book a visit. And when to stop at the red light. Go now. Thank you for being here. Wishing you and your family good health and wise living. See you in the next video.